I get as much from the show as my patients do. It really kind of helps to show the world that people with a skin condition, they're just like humans like the rest of us, and to treat them just the same. Hi, I'm Dr. Sandra Lee, also known as Dr. Pimple Popper, and I'm here to answer your questions about eczema. How did you become Dr. Pimple Popper? In 2015, I started an Instagram page to display my work as a dermatologist, but it was after posting a blackhead extraction video that I noticed that my audience really were kind of tuned in and they loved it. I began posting more content on social media and was really excited to see it gain traction. Do you personally struggle with any skin conditions? Many people don't know this, but I personally struggle with mild to moderate eczema, and I've had this since I was really young. What is eczema or atopic dermatitis? Atopic dermatitis is the most common form of eczema. It's a chronic skin condition that's triggered by an overactivation of the immune system. Common symptoms of eczema can include itch, inflammation, redness, and dry and scaly patches, and they can be persistent or they can come and go. How did you first discover you had eczema? I was diagnosed with eczema as a newborn and have had mild to moderate eczema my whole life. My parents tried their best to help me to manage it, but my flares carried on throughout my childhood and adolescent years, and I continued to struggle with symptoms like persistent itch and inflammation into adulthood. How has having eczema informed the way you treat patients with skin conditions in your practice? Living with eczema has really helped me to personally understand the impact that these conditions can have on daily life. As a dermatologist, this enables me to relate to my patients and connect with them on a more empathetic level. How does having eczema affect your day-to-day? I always do my best to avoid my eczema triggers. I also really avoid long hot showers and make sure to moisturize daily. When I'm experiencing a flare-up, the itch can be really distracting. This is also true for a lot of my patients. Scratching only makes it worse because of what's called the itch-scratch cycle. The more you scratch, the itchier your skin gets. Luckily, I've recently found a topical treatment called Opzelura that works to address my symptoms. What is Opzelura? Opzelura is a non-steroidal topical cream that's approved by the FDA for the treatment of mild to moderate eczema in certain people. I personally use Opzelura to help manage my eczema symptoms.
Opzelura can lower your ability to fight infections. Tell your doctor if you have or had an infection, TB, hepatitis B or C, blood clots in your legs or lungs, heart attack, stroke, cancer, high cholesterol, are a smoker, or pregnant. Opzelura may cause serious lung infections, certain cancers, immune system problems, blood clots, and low blood cell counts. Major cardiovascular events or death occurred in those 50+ taking oral JAK inhibitors. The most common side effect was the common cold.
Why did I decide to try Opzelura? Every now and then, I'll get a flare-up of eczema in my armpits that becomes really itchy and uncomfortable, especially when I sweat. I don't love using a steroid in that area, so I was excited to try Opzelura because it's a topical, non-steroidal formula that can be used in sensitive areas. What do you like about Opzelura? I like that Opzelura is a monotherapy, which means that I can use it on its own and I don't have to worry about using it in conjunction with other treatments. How quickly did you see an improvement after starting Opzelura? After using Opzelura, I noticed that the itchiness began to improve within a few days and my skin began to clear within a few weeks. Of course, this is just my personal experience and results might vary. If you're interested in Opzelura, be sure to talk to your own healthcare provider to see if it might be right for you. What is the Moments of Clarity program and why are you partnering with Insight for it? Moments of Clarity highlights the stories of people using Opzelura to treat their mild to moderate eczema and the defining moments throughout their journeys. I wanted to partner with Insight on this initiative and share my story as a way to show others with eczema that they're not alone and to encourage them to see a healthcare provider about treatment. How can others learn more about Opzelura? If you're curious about Opzelura, talk to your healthcare provider about the benefits and risks and to see whether Opzelura might be right for you. You can also learn more by visiting mymomentsofclarity.com.
Indication and usage. Opzelura is a prescription medicine used on the skin, topical, for the short-term and non-continuous chronic treatment of mild to moderate eczema, atopic dermatitis, in non-immunocompromised adults and children 12 years of age and older whose disease is not well controlled with topical prescription therapies or when those therapies are not recommended. The use of Opzelura along with therapeutic biologics, other JAK inhibitors, or strong immunosuppressants such as azathioprine or cyclosporine is not recommended. It is not known if Opzelura is safe and effective in children less than 12 years of years of age with atopic dermatitis. Important safety information. Opzelura is for use on the skin only. Do not use Opzelura in your eyes, mouth, or vagina. Opzelura may cause serious side effects, including serious infections. Opzelura contains ruxolitinib. Ruxolitinib belongs to a class of medicines called Janus kinase, JAK inhibitors. JAK inhibitors are medicines that affect your immune system. JAK inhibitors can lower the ability of your immune system to fight infections. Some people have had serious infections while taking JAK inhibitors by mouth, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses that can spread throughout the body. Some people have been hospitalized or died from these infections. Some people have had serious infections of their lungs while taking Opzelura. Your healthcare provider should watch you closely for signs and symptoms of TB during treatment with Opzelura. Opzelura should not be used in people with an active, serious infection, including localized infections. You should not start using Opzelura if you have any kind of infection unless your healthcare provider tells you it is okay. You may be at a higher risk of developing shingles, herpes zoster, while using Opzelura. Increased risk of death due to any reason. All causes. Increased risk of death has happened in people 50 years of age and older who have at least one heart disease, cardiovascular, risk factor, and are taking a medicine in the class of medicines called JAK inhibitors by mouth. Cancer and immune system problems. Opzelura may increase your risk of certain cancers by changing the way your immune system works. Lymphoma and other cancers have happened in people taking a medicine in the class of medicines called JAK inhibitors by mouth. People taking JAK inhibitors by mouth have a higher risk of certain cancers, including lymphoma and lung cancer, especially if they are a current or past smoker. Some people have had skin cancers while using Opzelura. Your healthcare provider will regularly check your skin during your treatment with Opzelura. Limit the amount of time you spend in the sunlight. Wear protective clothing when you are in the sun, and use a broad-spectrum sunscreen. Increased risk of major cardiovascular events. Increased risk of major cardiovascular events, such as heart attack, stroke, or death, have happened in people 50 years of age and older who have at least one heart disease, cardiovascular, risk factor, and taking a medicine in the class of medicines called JAK inhibitors by mouth, especially in current or past smokers. Blood clots. Blood clots in the veins of your legs, deep vein thrombosis, DVT, or lungs, pulmonary embolism, PE, can happen in some people taking Opzelura. This may be life-threatening. Blood clots in the vein of the legs, deep vein thrombosis, DVT, and lungs, pulmonary embolism, PE, have happened more often in people who are 50 years of age and older and with at least one heart disease, cardiovascular, risk factor, taking a medicine in the class of medicines called JAK inhibitors by mouth. Low blood cell counts. Opzelura may cause low platelet counts, thrombocytopenia, low red blood cell counts, anemia, and low white blood cell counts, neutropenia. If needed, your healthcare provider will do a blood test to check your blood cell counts during your treatment with Opzelura and may stop your treatment if signs or symptoms of low blood cell counts happen. Cholesterol increases. Cholesterol increase has happened in people when ruxolitinib is taken by mouth. Tell your healthcare provider if you have high cholesterol or triglycerides. Before starting Opzelura, tell your healthcare provider if you have an infection, are being treated for one, or have had an infection that does not go away or keeps coming back. Have diabetes, chronic lung disease, HIV, or a weak immune system, have TB or have been in close contact with someone with TB, have had shingles, herpes zoster, have or have had hepatitis B or C, have lived in, or have traveled to certain parts of the country, such as the Ohio and Mississippi River valleys and the Southwest, where there is an increased chance for getting certain kinds of fungal infections. These infections may happen or become more severe if you use Opzelura. Ask your healthcare provider if you do not know if you have lived in an area where these infections are common. Think you have an infection or have symptoms of an infection, such as fever, sweating, or chills, muscle aches, cough or shortness of breath, blood in your phlegm, weight loss, warm, red, or painful skin or sores on your body, diarrhea or stomach pain, burning when you urinate or urinating more often than usual, feeling very tired, have ever had any type of cancer or are a current or past smoker, have had a heart attack, other heart problems, or a stroke, have had blood clots in the veins of your legs or lungs in the past, have high cholesterol or triglycerides, have or have had low white or red blood cell counts, are pregnant or plan to become pregnant. It is not known if Opzelura will harm your unborn baby. There is a pregnancy exposure registry for individuals who use Opzelura during pregnancy. The purpose of this registry is to collect information about the health of you and your baby. If you become exposed to Opzelura during pregnancy, you and your healthcare provider should report exposure to Incyte Corporation at 1-855-463-3463. Are breastfeeding or plan to breastfeed? It is not known if Opzelura passes into your breast milk. Do not breastfeed during treatment with Opzelura and for about 4 weeks after the last dose. After starting Opzelura, call your healthcare provider right away if you have any symptoms of an infection. Opzelura can make you more likely to get infections or make worse any infections that you have. Get emergency help right away if you have any symptoms of a heart attack or stroke while using Opzelura, including discomfort in the center of your chest that lasts for more than a few minutes or that goes away and comes back, severe tightness, pain, pressure, or heaviness in your chest, throat, neck, or jaw, pain or discomfort in your arms, back, neck, jaw, or stomach, shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea or vomiting, feeling lightheaded, weakness in one part or on one side of your body, slurred speech. Tell your healthcare provider right away if you have any signs and symptoms of blood clots during treatment with Opzelura, including swelling, pain, or tenderness in one or both legs, sudden unexplained chest or upper back pain, or shortness of breath or difficulty breathing. Tell your healthcare provider right away if you develop or have worsening of any symptoms of low blood cell counts, such as unusual bleeding, bruising, tiredness, shortness of breath, or fever. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of Opzelura in people treated for atopic dermatitis include common cold, nasopharyngitis, diarrhea, bronchitis, ear infection, increase in a type of white blood cell eosinophil count, hives, inflamed hair pores, folliculitis, swelling of the tonsils, tonsillitis, and runny nose, rhinorrhea. These are not all of the possible side effects of Opzelura. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Incyte Corporation at 1-855-463-3463. Please see the full prescribing information, including boxed warning and medication guide, at opzelura.com.